Coming up this week on Talk with Audrey, Kenneth Mendez, CEO and President of the Asthma and Allergy Foundation, and Dr. Purvi Parikh, Allergy and Immunologist at Allergy and Asthma Associates of Murray Hill, have information about the impact of Asthma Peak Week on the asthma community and their recommendations for how patients can help reduce the risk of an asthma attack. Dr. Susanna Curtis, a clinical researcher who specializes in sickle cell disease. She's the assistant professor of medicine at the Icahn School of Medicine and the assistant director of the sickle cell program at Mount Sinai Hospital. She joins me with more information about sickle cell disease, the advances in treatment, and ongoing research. It's all coming up this week on Talk with Audrey. Insightful, intelligent, and inspiring conversations and information to help you improve the quality of your life. It's all about the business of living. I'll be right back after the break. You're watching Talk with Audrey. Welcome back. Did you know that the third week of September is known as Asthma Peak Week? Well, because asthma flare-ups and hospitalizations tend to spike around the time, it leads to over 22 million Americans living with asthma at risk. My guests today are Kenneth Mendez, CEO and President of the Asthma and Allergy Foundation, and Dr. Purvi Parikh. She's an allergist and immunologist at Allergy and Asthma Associates of Murray Hill. They join me today to talk about the impact of Asthma Peak Week on the asthma community and their recommendations for how patients can help reduce the risk of an asthma attack. Welcome.
Thank you.
Oh, thank you. I really appreciate you joining me. So let me start with you, Doctor. What causes asthma?
Right. So, asthma is a chronic lung disease in which there's inflammation as well as airway tightening and narrowing. So these are the two causes that makes people have the common asthma symptoms of, chest tightness, shortness of breath, coughing, wheezing, trouble breathing, and it can be triggered by a variety of factors. One of the most common is allergies, but also can be triggered by viruses and other environmental factors as well.
And during this peak season, what environmental factors wreak the most havoc?
I think what we're seeing, what Dr. Parikh described, was those symptoms manifest themselves in something called Peak Week, which is the third week in September, and that drives emergency room visits. We see a spike in emergency room visits and hospitalizations, and that's because of the fall allergy season and then the respiratory infections that she just mentioned. What a lot of people don't realize is that close to 10 people die each day from asthma. So it's really important to have your asthma under control, understand what your triggers are, and to work with your doctor to make sure that you don't end up in the emergency room or the hospital.
Kenneth, are there parts of the country that have higher pollen counts and pose a greater risk for people with asthma?
Yeah, absolutely. We just released our 2024 Asthma Capitals Report. And in that report, we look at the 100 largest cities and the ones that are most challenging to live in with asthma. And we use three things to create that ranking: emergency room visits, mortality, and prevalence. So if you rank high in all those three areas, then you'll be higher up on the list. So it's really important this time of year, especially during peak week, to make sure that you're working with your doctor to have the right medications, understanding what your triggers are so you don't end up in the emergency room or even death.
And what are some of the top cities that are identified in the report?
So the top 10 are Allentown, Pennsylvania, Rochester, New York, Detroit, Michigan, Springfield, Massachusetts, Philadelphia, Pennsylvania, Cleveland, Ohio, Lakeland, Florida, Baltimore, Maryland, Charleston, South Carolina, and Providence, Rhode Island. So those are the top 10, but you could go online to our website, aafa.org, Asthma Capitals, and look at the 100 cities and see where yours ranks.
Dr. Parikh, talk to us about treatment options. What's available?
Right. So, because asthma is that chronic condition that has both the airway inflammation and airway narrowing and tightening, it's really important that treatments address both of those factors to control your asthma well. So, many preventative medications do, but traditionally, rescue medications really only addressed the airway tightening side of it. But luckily now we have some new modalities that kind of target both the inflammation as well as the airway narrowing.
And where can we go for more information?
Well, one great resource, again, is modernageofrescue.com. And then I know Kenny has additional resources through his nonprofit.
That website is aafa.org.
Kenneth Mendez, CEO and President of the Asthma and Allergy Foundation, and Dr. Purvi Parikh, Allergist and Immunologist at Asthma Associates of Murray Hill, have been my guests. I want to thank you for joining me.
Thank you.
Thank you.
I'm going to take a quick break. I'll be right back. This is Talk with Audrey. Welcome back. According to the National Institutes of Health's National Heart, Lung, and Blood Institute, sickle cell disease is the most common form of an inherited blood disorder, and it affects more than 100,000 people in the United States and 20 million people worldwide. Joining me with information about the disease and advances in the treatment and ongoing research, Dr. Susanna Curtis, a clinical researcher who specializes in sickle cell disease. She's assistant professor of medicine at the Icahn School of Medicine and the assistant director of the sickle cell program at Mount Sinai Hospital. Welcome.
Thank you so much for having me here today.
It's my absolute pleasure. Would you give us an overview of sickle cell disease?
Sure. So many things, but I think the simplest explanation. So it is, as you said, an inherited disorder. So people are born with it and have it their entire lives. And it is a recessive disorder. And what that means is that everybody gets two genes for their hemoglobin, which is what's in the red blood cell affected by sickle cell disease. And if you only have one affected gene, you don't have sickle cell disease. You have something called sickle cell trait. But if you have two affected genes, a gene from each parent, that's when you have sickle cell disease. And so you may have two people who may not know that they are carriers that have sickle cell trait that have a child with sickle cell disease. And when one has sickle cell disease, the red blood cells will occasionally take on a sickle shape. And in that shape, they're no longer easily able to flow through the blood vessels. And they block it up. They really cause a traffic jam. And when that happens, that means that the other blood cells can't get beyond that traffic jam. And so the parts of the body beyond that jam that are looking for the oxygen that the red blood cells carry can't get that oxygen anymore. And if you don't have oxygen, then cells die. And so the most classic thing that can happen from sickle cell disease is something that is called a pain episode, where there is a blockage of the blood vessel, then there is no more blood flow, parts of the body are deprived of oxygen, cells die, and that causes incredible pain that can last for days to weeks. But sickle cell disease can also be a progressive disorder. So these blockages of blood flow are really happening all over the body. And so as people with sickle cell disease get older, their bodies can repair a certain amount of damage, a little bit of damage here, a little bit of damage here, blockage, no oxygen, a little bit of damage. But eventually, one can only do so much repairing. And so as people with sickle cell disease age, they are at risk of developing damage to all of their organs, to their heart, to their lungs, to their kidneys. And so not only are these pain episodes a concern, which of course are a horrible thing, but also as a person with sickle cell disease ages, they develop this organ damage over time. And so people living with sickle cell disease, despite the many advances that we have made, still unfortunately have a median age of mortality about in the late 40s, early 50s.
And what are some of the current treatment options that are available for people with sickle cell disease?
So right now we have 4 approved medications for the treatment of sickle cell disease. And that may not sound like a lot, but when I was in training, we had 1. So 4 is actually really exciting. And the other thing is that there are a lot more medications being studied now. And so I think if we were to have this conversation a year from now, if we were to have this conversation 5 years from now, we're going to have a lot more treatments. And they really are making a big difference. So the first medicine, and this is a medicine that we've actually had since the 90s, is something called hydroxyurea. And hydroxyurea is a pill. And we first found that it was effective for helping people have less pain episodes, which of course is very valuable. But now that we have had it over decades and we have seen the effect of people taking it over decades, what we've learned is that when people with sickle cell disease take hydroxyurea, not only do they have less pain episodes, but they actually live longer and they actually have healthier organs. So it's probably our most important medication right now. We have 3 medications that were approved more recently. One is called Endari, and it's actually a protein powder. It's L-glutamine. And when people take that powder twice a day, it is able to help deal with a little bit of that damage, and people also have less pain episodes on it. We also have a pill called Oxbryta that helps the red blood cells sickle less often. And by sickling less often, that anemia, that low level of red blood cells, actually gets better, and people's hemoglobin level and red blood cell level becomes higher. And finally, we have a medicine that's actually an antibody. And so it actually is something that people get through an IV once a month that helps the blood be less sticky. It's called crizanlizumab or Adakveo. And by the blood being less sticky, then there's less of those vaso-occlusion episodes. And again, people have less crisis. We also, besides medications, will sometimes in certain circumstances use blood transfusions. So people with sickle cell disease, it's also called sickle cell anemia because they all do have very low levels of red blood cells. When the red blood cells sickle, they get destroyed. They don't live as long. And they have those low blood numbers, which can cause a lot of effects. And so sometimes we'll actually give people blood transfusions to try to ameliorate some of these problems.
Would a sickle cell patient receive a combination of those treatment options that you just spoke about?
Yes, absolutely. So because we have had hydroxyurea for so long and we know about so many of its good effects, when these newer medications were studied, the people that studied them were pretty smart, and they made sure that about half of the people that came on the study just got the new medicine, but about half of the people on the study were also on hydroxyurea. So all 3 of those new medicines we know work well with hydroxyurea and that they can be taken together and have good benefits. In terms of those 3 in combination, each one was kind of studied on its own, so we don't have a formal clinical trial showing that those medicines are safe together. But certainly when we look at how each medicine works, clinically, it seems like it should be safe. And I do have patients that are on multiple medications because sometimes, a patient is on one medication to have less pain episodes and they're having less, but they're still having more than they would like. So sometimes we add a second medication and now they're having even less pain episodes, and that can be really good for their quality of life. Or sometimes I'll have a patient who's having a lot of pain episodes and also often has really low blood levels. So then we'll give them a medication to make their blood levels higher and a medication to help with the pain episodes. And again, that combination can be really helpful.
I've been speaking with Dr. Susanna Curtis, a clinical researcher and assistant director of the Sickle Cell Program at Mount Sinai Hospital. We'll be right back after this quick break. You're watching Talk with Audrey. Welcome back. My guest is Dr. Susanna Curtis, a clinical researcher and assistant director of the Sickle Cell Program at Mount Sinai Hospital. We've been talking about new sickle cell medications, treatments, and ongoing research. Dr. Curtis, what about new or emerging treatments? Are there any on the horizon aside from the treatment options that you mentioned previously?
There are, and it's really exciting. There is a lot more focus on sickle cell disease research than there was even 10 years ago. And so there are now a lot of medications in study, a lot of clinical trials going on looking at, can other medications work to help pain episodes happen even less often? Can other medications work to help patients have less pain every day, feel less tired, have more energy? Are there medications that will help people live longer? That's a very important goal. And they're looking at a variety of methods, which is exciting because, of course, we would can we combine medications to get an even better effect? And so there's a lot of things really coming around the horizon. It's an exciting time.
Are there any clinical trials that are related to sickle cell disease that patients can participate in?
There are so many. And, that is how these new medications get developed. I mean, how would you know if a medicine did anything if you didn't have people with sickle cell disease willing to take it, which is such a gift that somebody is willing to do that, not knowing if something's going to work, but willing to try it so that we can try to learn more, to try to help people in the future. I mean, what a wonderful thing for somebody to be willing to do, willing to give of themselves and of their time that way. And so, for all these drugs that we're trying to see if they work in different ways, there's lots of clinical studies happening all over New York, happening at Mount Sinai, happening all over the United States and in other countries beyond, to try to examine these medications. If somebody is interested, either because somebody has found that they've tried the treatments that are out there and they aren't doing a good enough job for them and they would like to try other things. Or if somebody is interested because they think to themselves, I want to try to help other people with sickle cell disease in the future, and let's try to learn to see if this thing works or not. There are multiple ways to find out about what trials are out there for them. One is that there is a website called clinicaltrials.gov. And that website lists every single clinical trial that is going on in the United States of a new medicine or drug. And so what you can do is you can type in sickle cell disease and you can see what pops up, and you can click on that trial and you can see where it's being run and who's running it. And if you're interested, who do you contact? You can also, of course, ask your physician, what trials are out there that I might be able to join. Because sometimes maybe the physician might not have a trial that you're able to join, but maybe they might know, this other physician at this nearby facility does have a trial of this new medication, and that's something that might benefit you. So maybe you want to go there and see them and see if you want to try that.
You mentioned there might be some curative options, hopefully, coming down the pike. Can you talk a little bit about those?
Yeah, so it's really exciting. There are both curative options that are coming down the pike, and there are actually curative options that we have now. So we know that all of the cells in the blood are made on the inside of the bones, in the bone marrow. And so the first curative option is there's actually something called a bone marrow transplant. So if somebody has sickle cell disease, that means that the red blood cells that their bone marrow makes are capable of sickling. But what we're able to do is actually give them somebody else's bone marrow. And if they have somebody else's bone marrow, well, now they're not going to make sickle cell disease anymore. So a bone marrow transplant is a cure for sickle cell disease. However, there are challenges. The bone marrow also makes the immune cells, the cells that fight infections. And those cells are programmed so that if they see something that looks like not the person that they're used to, they will attack. And so if somebody wants to get a bone marrow transplant to cure their sickle cell disease, it's important that the donor, the person whose bone marrow they're going to get, is what we call a match for them, meaning that their immune systems look similar enough that we don't think those cells are going to cause any problems. And it can be hard to find a match. So generally, if somebody has a sibling that they share both parents with, there is a 25% chance that that sibling will be a match. There is also a national registry. It's called bethematch.com, where anybody can go that might be willing to give their bone marrow to somebody with sickle cell disease or to other diseases that a bone marrow transplant can be a cure for, such as cancers. And there, similarly, they can compare the person with sickle cell disease and see, is there anybody in the registry whose immune system looks close enough to them that they could potentially be a donor. And so for patients who have a match, that is a potential option, that they can get that other person's bone marrow, and then they'll no longer have sickle cell disease. There are certainly challenges with a bone marrow transplant beyond finding the match. In order to give a person new bone marrow, you first have to make sure that their old bone marrow isn't there anymore, because you want to make sure the new bone marrow grows. If the old bone marrow just grows back, then they'll have sickle cell disease again. And often that is done with chemotherapy, which, depending, we're actually much better at giving gentler chemotherapies these days as opposed to stronger ones. But that certainly can be a concern. So somebody has to be healthy enough to go through that and sort of to understand that, you are going to get some doses of chemotherapy. You're going to be uncomfortable for a bit, even though you're getting to something that eventually will be wonderful. And so that is something that we've had for a long time. And what we've had that was just approved this year are two different forms of something called gene therapy. And so what's wonderful about gene therapy is you no longer need a match. Instead, what we do is we take the person with sickle cell disease's bone marrow, and we take those cells and we put them in a lab. And while they're in the lab, we do different things, and we're still learning what the best gene therapies are. There are two that are approved right now. We don't know if one is better than the other yet. They both use slightly different ways to make the changes to the genes, and they both make slightly different changes. But all of these gene therapies try to change the genes in ways that will make the sickle cell disease cause less problems. Then those cells are grown. And then, just like the bone marrow transplant, the person does have to receive some chemotherapy so that their old bone marrow goes away. And then they get that new bone marrow that is actually their own bone marrow that's been modified. So that is another, we think, cure.
Tell us more about the sickle cell program at Mount Sinai Hospital.
Sure. So we have probably one of the largest national programs, though not the largest. So we take care of adults living with sickle cell disease. So that starts at age 21. We have about, I would say, around 800 patients, though it's growing, which is wonderful. And we're always happy to see more people. And we try very hard to really offer comprehensive care. So we do have an outpatient clinic 3 days a week where we see people, talk about how they're doing, what medications might help them, what follow-up should we be doing, and also offer them opportunities if they're interested to participate in clinical trials. That might mean a treatment, or that might mean just being willing to share information. But we also have an inpatient group as well. So if, heaven forbid, somebody is sick and ends up in the hospital, we will also make sure that the same people that were caring for them in the clinic go to see them in the hospital and make sure that they are getting the right treatment for them, and kind of talk to the other doctors taking care of them, explaining, we know this person, they have sickle cell disease, this is what we recommend for them. And we do really try to be a place that can offer a lot of options for people. So we have 3 physicians. We also have 2 nurse practitioners. But we also have a fabulous social worker, because often people living with sickle cell disease, unfortunately, have to deal with insurance, have to deal with problems at work that can come from their disease, might need care, might need transport. So we want to help people with all of those issues. We have wonderful administrators. And again, actually a very large clinical trial group, because we think that if you're going to take good care for people living with sickle cell disease, there's so much right now that we don't know, that we need to learn, that good care is not only giving them the best medicines that are approved and the best treatment that's approved, but good care is giving them the opportunity, if they're interested, to participate in clinical trials.
Where can we go, Dr. Curtis, for more information about Mount Sinai's program?
Sure. So if you want to find more about the sickle cell program at Mount Sinai, our website is icahn.mssm.edu /research/sickle cell disease. And this actually does have information about the entire center, not just research opportunities. So people are very welcome to go to that. And there will be links there if they want to get in touch with us.
My guest has been Dr. Susanna Curtis, a clinical researcher who specializes in sickle cell disease, and she's assistant professor of medicine at the Icahn School of Medicine and assistant director of the sickle cell program at Mount Sinai Hospital. Thank you so much for joining me.
Thank you.
And join me next week for part 3 of my series on sickle cell disease and my conversation with sickle cell patient Mendez Davidson and her daughter Kasara. They share their journey and the challenges of living with sickle cell disease. That's it for this week's show. I'm Audrey Adams. Join me here next week for more insightful, intelligent, and inspiring conversations and information to help you improve the quality of your life. It's all about the business of living. I'll see you next week.